What's up guys? Welcome back to my channel. It's me, Daddy Koy. Kamusta? We are going to talk about yung pinakamainit na question na na-receive ko sa mga previous nursing vlogs natin. Ang tanong, magkano daw ba ang sweldo ng nurse dito sa States? Okay, nursing salary varies actually depending from which state you live in. Okay? This is not a secret that California nurses makes more compared to other states. So on this particular video, I am discussing or focusing more on the salaries of California nurses kasi dito ako nakabase kasi ayokong pag-usapan yung mga bagay na hindi naman ako sigurado, 'di ba? Para hindi tayo parang mukhang epal. so dito lang. And also, most of my friends are based here in California, NorCal and SoCal. So I have an idea yung differences nila. So base sa mga datos na aking nakalap, based sa mga data, mas malaki ang sweldo dito sa NorCal compared sa SoCal. Okay? Probably because of the highly desirable cities to live in, weather, cost of living, I don't know. Hindi ako sigurado. So there are different factors affecting nursing salary, okay? So first, depende on what type of facility ikaw magtatrabaho. Pwedeng hospital settings, SNF, clinics, or outpatients, diba? Syempre, mas malaki ang hospital pay compared to a SNF or skilled nursing facility, which is a subacute, diba? And mas malaki ang subacute compared sa clinic kasi it's an ambulatory and outpatient, in and out lang ang pasyente doon. Pangalawa, position. Admin nurses makes more because they are salary, diba? But the downside nun, pag nag-work sila overtime, thank you yun. OT yun, diba? Thank you meaning walang bayad, libre. Kasi part yun ng job nila. Pero kung floor nurse ka or mga non-exempt ka, hourly ka. So pag nag-overtime ka, more chances of winning. More money. But more money meaning more taxes. Pangatlo, unit. So it varies from one unit to another. So there are some hospitals na kapag nasa ICU ka, mas malaki ka. Pag nasa med-surg or telemetry ka, mas less ng konti. Merong mga ganun. But merong hospital naman na they depend your salary dun sa experience mo. Kung anong entry level ka ng nursing, level 1, level 2, dun nila binabase. Also, connect ko na din, if yung hospital na pagtatrabuhan mo ay may union, meron silang set standard or set ranges kung magkano magiging sweldo mo. For example, 1 to 3 years experience, for example, $50. 4 to 6 years experience, $52. Something like that. Mga ganun. Meron silang set standard. Yun yung kagandahan sa union. At pang-apat, shift differential. So, meron tayong mga tinatawag na shift differential dito sa States. I think meron din naman yun sa ibang lugar. So, kapag nag-work ka ng weekends, o kaya naman knock shift, or kaya naman night shift, meron mga differential yan. So, for example, you are working 8-hour shift. Alright? So, you have morning shift, AM, PM shift, and knock shift. Usually, AM shift doesn't have shift differential. PM shift has a little bit of pay differential, but knock shift for sure. So this shift differential varies from $1.50 to $5, depending on the hospital policy. And then, if you are working 12-hour shift naman, kasi dito sa California, I've heard there are hospital na 12-hour shift, so meaning 3 days a week yung trabaho mo. And then, meron din namang 8 hours shift. Pwede kang mag 4 or 5 days. So, if you have 12-hour shift, then merong differential yung AM after 8 hours. So, the last 4 hours of your shift has pay differential. And then, for the knock shift, ang pay differential is the last 8 hours. So, pwedeng ganun. Then, pag weekends, meron din yun. On top of, kunwari, knock shift ka. So, may knock shift differential ka. So, if you work on weekends, patong ulit yun. So, meron ka ulit na weekend differential. So, doon lumalaki yung mga sweldo. So, parang siyang bonus na din. Parang ganun. At syempre, pag nag-overtime ka, time and a half yun. Kunwari, ang sweldo mo is $50. Pag nag-overtime ka ng 1 hour, yung 1 hour overtime mo magiging $75. Okay? So, ang kagandahan dun sa 12-hour shift kasi, 3 days a week ka lang magtatrabaho. So, pwede ka pa mag-part-time sa iba. Again, kung masipag ka, more money, diba? Pero, more money, more taxes. So, on this picture, you will see that on the metropolitan area, San Jose, Sunnyvale, Santa Clara County makes more compared to the other counties or cities. San Francisco will be next to it. And then Santa Cruz, Salinas, Vallejo, Fairfield, and Sacramento, Roseville. So actually, I live in Sacramento, Roseville area. That's the average hourly wages for RNs. So this next picture is the top paying states for nursing. So California, again, sinabi ko na kanina na California makes more than the other states, followed by Hawaii, and then Washington, D.C., Massachusetts, and Oregon. So those are the top 5. So guys, nakita niyo na yung possible average salary of nurses depending on which area ikaw magbabase. Pero meron ako mga kilala na it ranges from $18 to $80 an hour or even $100 depending on the institution or hospital. Kasi may kakilala ako sa Kaiser, meron silang $100 an hour. Merong iba na $120 an hour. For LVNs naman, syempre hindi natin sila makakalimutan. Their salary ranges from $18 to $43 depending on which setting or field sila mag-work. Pwede silang mag-work sa home health and hospice, sa medical offices, outpatient, sa jail. Wala akong nakikitang LVN sa hospital. Correct me, comment down below if meron sa state nyo. Pero dito sa California, I haven't seen LVN work in a hospital. Like on a surgical floor or ICU and so on and so forth. So for RNs naman, maraming options. So you can work sa hospital for sure. Any department. Jail. Psych. Hospice and home health care, outpatient clinic, medical offices, and so on and so forth. So on a personal basis naman, i-disclose ko yung mga naging past previous salary ko. So kung napanood niyo yung vlogs ko, yung nursing journey ko, wala akong acute or subacute experience before nung nag-umpisa ako. So nag-start ako as a home health nurse. Okay? So I started in a small Russian company. And ang bayad sa akin doon is per visit. So, I think ang per visit ko noon, back in 2011 or 12, ang per visit namin noon is $55 an hour. That's in San Francisco. And then, ang admission namin, $125. So, that's per visit kasi yung admission, mas marami siyang documentation. And then, yung revisit naman is just follow-up. And meron siyang additional na parang $5 per visit para dun sa mileage and gas mo. Sa per visit kasi, hindi bayad yung travel time. So, yung pag-travel mo from one patient to another. So, kung meron kang 6 patient that day, and then it took you like, 2 hours of driving, hindi yun bayad. So, yun yung kagandahan naman sa hourly job nung nag-transfer na ako sa next job ko. So, yung hourly rate ko naman nung home health nurse ako was, I think I started $40. Then, I stayed there for almost 2 years. So, tumaas yung sweldo ko up to $43 an hour. Then, I moved to a bigger company. So, I think my hourly rate back then, so home health pa rin to, was $54, $55. Something like that. Hindi ko na siya masyado matandaan. So, mga boss, actually, magdedependin pala yung salary mo kapag marami kang certification na hawak, 'di ba? Kung ang certification mo is RN, standard 'yon. Pero pag may BSN ka, tapos meron ka pang MSN, kung may PHN ka pa, so depending yun, dagdag ng dagdag yun, bawat certification mo. So mga boss, usapang home health, i-disclose ko sa inyo na depende sa position nyo, yung salary nyo din. Kunwari, preceptor kayo, iba yung salary mo compared to a regular case manager. Kung IV therapist ka and case manager at the same time, iba rin yung rates mo. Kung admission nurse ka, iba yung rates mo. Kung preceptor ka, iba yung rates mo. So, it varies kung ano yung position mo din. So, guys, by the way, hindi ko ma-disclose kung magkano yung salary ko ngayon kasi hindi pwede. Actually, dito sa States, sobrang off or inappropriate kapag pinag-usapan yung salary or pag tinanong mo, magkano sweldo mo? Sobrang inappropriate yun. Sa 10 years ko dito sa States, I never encountered a colleagues na nagtanong kung magkano yung sweldo ko. Usually, pwede sila magtanong, magkano yung ranges or magkano ang starting. Yun, pwede kong sagutin, pero yung sarili kong sweldo, hindi namin pinag-uusapan kasi isa sa policy yun. No, bawal pinag-uusapan ang sweldo. So yun guys, hindi ko ma-disclose sa inyo kasi may mga katrabaho ako na baka mapanood ito. Kaya hindi ko ma-disclose kung magkano yung rate ko ngayon sa home health as a wound care specialist and sa hospital as a wound ostomy specialist. Pasensya na po. So bago ang lahat guys, bago kayo masilaw sa mga presyo na yan, mga numbers na yan, okay? Pag-usapan natin ano ang nagpapababa sa take-home namin, okay? Sabihin na lang natin na 1,000 yung dapat na susweldohin namin sa isang paycheck. Pero hindi 1,000 mauuwi namin sa bahay. Siguro mauuwi namin mga 550 lang. Ito yung mga factors kung ano ang nagpapababa sa sweldo namin. So guys, may cheat sheet ako dito. So here in California, we have two taxes, main taxes, federal tax and state income tax, diba? And then also, kasama sa i-deduct sa salary mo is yung Social Security, Medicare, State Disability Insurance Tax, and also sa mga pre-tax deduction naman is yung medical insurance. So, good thing dito sa hospital na pinagtatrabahoan ko, yung medical insurance is 100% covered. So, any expenses, wala kaming babayaran. Co-pays lang kapag mga doctor's appointment. Then we have dental coverage and the vision insurance. Both of these items are 100% covered by my company. But, kinuha ko yung premium. So, just in case meron kaming going extensive dental work, at least wala kang babayaran. Diba? Kaya kinuha ko na yung premium. So, meron akong konting binabayaran dito. Sa vision insurance naman, covered din siya, pero kinuha ko yung premium, so I have to pay a little bit. Okay? Kasi yung asawa ko, malabo yung mata niya, so she requires multiple tests in a year for glaucoma, astigmatism, and so on and so forth. And then, para makover yung full glasses niya, eyeglasses, reading glasses, diba? Para wala kang babayaran, konting-konti lang. And then, syempre, kailangan niya rin for contact lenses. So, kaya ako kinuha yung premium para sa kanya talaga. Pero para sa akin, yung sa akin kasi, basic lang. Kasi, okay naman. O, hindi naman ako nagsusuot ng reading glasses or kung ano man. And then, aside from those, syempre, i-deduct din dyan yung 401k retirement mo. So, nagbibigay ka dyan ng ilang percentage, diba? From 3% to up to 12%. So, depende yan kung magkano yung i-donate mo para sa future mo, future retirement mo. And then, life insurance. So, merong pinoprovide yung company namin na basic insurance, basic life insurance, pero ang kinuha ko yung premium ulit para sa akin, sa asawa ko, at saka sa anak ko. Maganda, ready ka? Also, critical illness, meron din yan. Covered siya ng company, pero dinagdagan ko pa yung amount. So, kunwari, ang covered ng company is $100,000. So, ginawa ko siyang $200,000. Parang ganun. Pero hindi yun yung binabayaran ko. Maliit na amount lang. Contribution. Parang ganun. Tapos, FSA or yung Flex Spending Account, nasa iyo yan kung gusto mong mag-donate doon para sa gagamitin mo. Pre-tax naman siya eh. Kung meron ka mga upcoming projects, meaning kung gusto mong magpa-braces, gusto mong magpa-LASIK, pwede mong gamitin yung FSA. So, right now, wala kaming FSA kasi yung company namin, meron silang binibigay na parang $500 ata a year for us to use sa mga copay and so on and so forth. So, free yun. Freebies namin yun. So, yun yung mga factors na nakaka-affect ng salary namin. Kaya akala nyo na yung mga nurses, malalaki yung sweldo. Yes, malalaki yung sweldo, pero malaki rin yung mga dinededuct sa amin. So, again, more money, more taxes, diba? Tsaka, kala ng iba na mayaman ang nurses. Siguro yung iba, pero sa sitwasyon namin, hindi. Komportable. Syempre, dollar ang sweldo, dollar din yung gastos. Hindi naman, porket dollar yung sweldo namin, peso na yung gagastusin. Sapat lang, sapat lang. Nakakaipon ng konti, nakakatulong kung kailangan. So, yun yung buhay namin dito. So, yun lang mga boss, yun yung mga factors na nakaka-affect kung paano lalaki yung sweldo mo, depende nga doon sa mga sinabi natin kanina, or paano naman mababawasan yung malaki mong sweldo dahil nga dito sa mga taxes at mga additional deductibles. But then again, guys, nursing is not for everyone. If you are taking up nursing or if you are an aspiring nurse because you're thinking na ang daming pera dito, wag mo na ituloy. Oo, madaming pera pero it needs passion. Kasi kung ikaw yung klase ng taong takot sa dugo, takot sa needles, you hate seeing poop, you hate wiping poops, diba? Or hindi mo makayang mag-treat ng wounds, or hindi mo kayang makakita ng phlegm, or things like that, hindi para sa'yo to. So guys, if you want to learn something every day, or you wanted a career, or a profession that is challenging, interesting, and makes difference in people's lives, then nursing is for you, okay? It's not all about the money, guys. It's not all about the money. It's all about passion. So guys, that's it. If you like this video, please click the like button down below para alam ko naman na gusto niyo yung mga ganitong content. And comment down below if you wanted to know more about nursing. Anong topic ang gusto niyong pag-usapan next time para I have an idea naman, para it's a collaborative vlog. Gusto ko din na pag-usapan, diba? And also, please subscribe if you haven't already and please click the notification bell down below para ma-notify ka ng mga bago nating video. Maraming salamat po guys and thank you for watching. Laters!